Aloha, thank you so much for joining us for today's webinar, Staying Active and Healthy. My name is Dr. Doug Kwok, and I'm here to facilitate today's conversation. This Hawaii Pacific Health webinar event is focused on providing helpful information to the community regarding physical activity, including the long-term effects of staying inactive, effectively building back a regular fitness routine, and how to safely participate in virtual community events. Before we get started, a few reminders to our viewers. Today's webinar will be recorded. After the event is complete, registered participants will receive a copy of the recording. The event will also be available to view on our social media channels. And for those joining us live, please feel free to submit questions using the Q&A button at the bottom of your screen. We will do our best to answer as many questions as we can during the Q&A portion of the event. So we're going right into our speaker intro. We're so lucky today to have several experts joining us for today's discussion. First, Dr. Spencer Chang is a fellowship-trained sports medicine orthopedic surgeon at Palimomi Bone and Joint Center. His spare time, he serves as an orthopedic consultant for the World Surf League and is a team physician for Chaminade University. Dr. Jill Lenoy is a primary care sports medicine physician with the Hawaii Pacific Health Bone and Joint Clinic at Palimomi. She specializes in non-operative musculoskeletal care, concussion management, and enjoys trying to help patients actually reach and achieve their activity goals. And then we have Dr. Asa Mills, who is an outpatient physical therapist at Straub Medical Center, who specializes in orthopedics. He is originally from Washington State, went to undergraduate and graduate school at the University of Miami, and enjoys surfing, diving, martial arts, running, and hiking. Thank you all for joining us today. So we're gonna go right into it with regards to our topics. And we're gonna start with COVID effects on health and inactivity. And I wanna start with you, Dr. Chang. How has this COVID pandemic impacted active lifestyles and people in Hawaii?
Well, the bottom line is that, we have to social distance and physically distance now. And with all the rules in place, wearing masks and keeping at least 6 feet apart, a lot of sports you can't do anymore. So you can't do contact sports like football, basketball, or I guess you could a little bit, but you have to practice in groups of 5. You might have to wear masks. You can't go to the gym quite as much as you used to. They canceled OIA sports completely. And a lot of the club sports, they're now, you can't do a lot of the club sports. So it's impacted a lot in terms of not only kids who like to play sports, but athletes as well, who are adults and in club sports and gyms and stuff. And so, they had this recent thing that Chad Owens and Andrea Tupelo were getting started Safe Sports 808, and I think that's one of the things that they're trying to do to get back to sports. But obviously, there's not a lot of sports going on like before because of COVID.
Yeah, Dr. Noy, gyms have closed, pools have closed. How has that also impacted the people of Hawaii with regards to not having a place where they routinely maybe previously were doing
Right, like a lot of my
exercise?
patients, they were active, like going to the gym, and they said, well, now I haven't been able to exercise because the gyms are closed, or they don't feel comfortable going to the gym. Even just like getting outside, some of my patients say, oh, I usually go walking, but there's so many people walking now, so I haven't gone walking. And that can have effects on their health. I mean, we want everyone to be active as they can. And a lot of my patients, and I'm sure everyone has heard about this, about the weight gain during this pandemic. And a lot of my patients, like, I've been gaining so much weight because I haven't been able to exercise like I usually do. And it's not only the weight, but there's other, general medical conditions that are, if we can't exercise, even certain cancers, can be risk for certain cancers if they can't exercise. And so there are a lot of, unfortunately, detrimental effects if we can't exercise like how we would like to.
Yeah, good points, Dr. Chang and Dr. Noy. Dr. Mills, Keiki in adults, how has this decrease in activity impacted the individuals and their health?
Uh, well, first of all, as a physical therapist, I'm seeing, a lot of people coming into the clinic with things related to working from home. So a lot of people have been working from home for the better part of a year now, and may have had their workstation ergonomics more dialed in at the office, but now they're home. They're working on, they might be sitting on the couch, working on a laptop, working in bed. Uh, a lot of worse ergonomic positions, and that seems to be leading to some people getting back pain, neck pain. Sometimes you'll see things like headaches, shoulder pain, carpal tunnel, uh, related to the ergonomics. So I think it's important definitely for those people who are working remotely and working from home to uh, keep in mind ergonomics still matter. Try to sit up straight, take breaks. I'm a big fan of the sitting and standing desks too. So working part of the day standing up seems to help out with a lot of those effects. Uh, Also, just noticing some of the effects of deconditioning, like Dr. Inouye and Dr. Chang were mentioning. A lot of people have really been thrown off of their usual fitness routines and they can't play sports, maybe not going to the gym or doing some of the things they did before. And you notice the effects of that with relation to physical therapy and orthopedic issues too, because people are getting maybe joint pain that is worse now because their muscles have gotten weaker, uh, pain worse because of weight gain. Also, flexibility tends to decrease when we're less active. So just noticing those effects. Also just noticing with the change of activities. So a lot of people, because they can't do the normal things that they do for exercise, they're doing something different. Like for example, they might have started a new workout routine at home on YouTube or something, or they may have just started running. Running's a option that a lot of people turn to because it's socially distanced and you don't need a gym or anything to do it. And while running's great, a lot of the time, if you're not used to it, you increase too quickly, see some injuries related to that. So seeing some knee, hip, ankle issues from people running more than their bodies are really prepared for.
Mhm. Yeah, I don't know if you noticed, Dr. Mills, but when you mentioned bad ergonomics, I sat up straighter in my chair and tried to improve
Good.
the posture.
Hopefully the people at home are doing that too.
Yeah, right. Dr. Inouye, how do you talk to your patients about this inactivity?
So everyone's a little bit different. Right, like everyone's levels are a little bit different. Some people can handle a lot more activity, while some people, it's just even hard just getting around the house. And so I kind of tell them for things like Dr. Mills was mentioning, some with stiffness, arthritis. Actually, movement is good. If you can get out there and move, light activity is usually good for arthritis and things like that. So I usually try to have them start off slow. Um, do what they're comfortable with, something that they enjoy, because like kind of mentioned earlier, the activity is good, like for the joints, for arthritis that we mentioned, but for the heart, for the lungs, and I actually forgot to mention it's good for the mood. And sometimes that's really good for patients, especially during this time of COVID. It's probably difficult for a lot of people to be staying in the house. It's, a lot of depression and anxiety, and exercise can actually help that. And so when I talk to my patients about getting more active, those are some of the benefits that I talk about doing the exercise, and just the benefits of it. And sometimes I talk to them about how we can start off with certain exercises and how they can progress depending on what level they're at.
Yeah, that was a great discussion on the inactivity and what COVID has done for us. Let's have a discussion into how do we get people getting back into a workout routine. And Dr. Chang, going with you, it can be difficult to motivate people to get back into a physical routine. How do we encourage people to do that?
Okay, so I'm going to give my pep talk. So one of the
Up.
things, one of the things about physical inactivity is that let's basically call it an epidemic, similar to like, I guess COVID is a pandemic. So the World Health Organization, okay, they have actually listed physical inactivity as something basically that contributes to 3.2 million deaths globally in the entire world per year. So if you think of causes, non-communicable diseases that cause different things, physical inactivity kills 3.2 million people a year. And if you put that in perspective, we had about over 2 million COVID deaths worldwide in the past year. And, it almost makes you wonder if the president should mandate exercise as part of the, to promote better health in not only masks and physical distancing, but to actually physically exercise. Because, if you look at the studies, if you exercise maybe just 20 minutes a day versus not doing anything, you could lower your risk of premature death by 16 to 30%. In some studies, up to 45%. Some studies say that it's the main primary risk factor for a premature death. Right now, the World Health Organization says it's the fourth, but that compares to things like smoking, high blood pressure, or diabetes in general. If you've just physically exercised, that's going to lower your risk of having premature death. And I think knowing that alone, I think everyone should go and exercise just because of that.
Yeah, that's motivation right there, quoting statistics on health and death, but not everybody is in the same stage with regards to their inactivity. Some maybe have been doing a little bit more than others. So would you recommend any certain activities? Are some activities safer than others to help people get moving?
So that's a great question. So I think you're right. Everyone has to do things at their own pace. And certainly if you go and if I were to try to run a marathon tomorrow, I'd probably get a cardiac arrest, because I haven't been training for it. And I think it's important to go at your own pace. And when you look at the research out there, you don't really have to do vigorous exercise. You really just have to do moderate exercise, about 150 minutes a week or so. And that could be a whole lot of different things. And it's really up to us to kind of use your creativity to figure out what you want to do. It could be swimming, it could be walking, it could be going on a Stairmaster, using a bike, it could be doing Tai Chi, it could be doing yoga, it could be doing so many different types of exercise. And obviously COVID changes things up a little bit, but you can really figure out ways how to do things even during COVID times.
Yeah, Dr. Mills, you do martial arts too. You heard Dr. Chang mention Tai Chi. You have any other activities that you could contribute to a safer way of getting moving?
Yeah, I mean, I think that's the list is endless. Tai Chi is a great place to start. That one's been shown to particularly be beneficial for our kupuna with regards to balance and just general well-being. Also, I think another thing that helps when people are trying to build good physical activity and exercise habits is try to find something that's fun. If you're making yourself do something that you don't enjoy, it's going to feel like a chore. It's going to be a lot harder to stick with that. So if there's an activity, maybe it's a sport, maybe swimming, hiking, surfing, something like that you enjoy doing, even if you haven't done it for years, maybe something you could start back up again. I think that's a great place to start. Is it just a fun activity that happens to be exercised at the same time? We might have to think back to childhood sometimes and think about some of those things that we used to do. And if they're things you could still do, go ahead and give them a try again. I also think social support plays into that. So if you can get a friend involved too, we have to be socially distanced now, but a lot of things can be done outside and are relatively safe. So if you have a friend or a family member that, for example, wants to start a walking routine with you, that would be a good place to start. You can even use, go for a walk and use that time as a time to catch up on your telephone calls. Just watch out for traffic at the same time. Also, I think when starting a new routine, it's really important to start small. A lot of people, they try to start a routine, they make really, really lofty goals, set a really high standard for themselves, and then they end up falling short of those goals, and a lot of the time that derails their progress. They might end up discouraged and just stop exercising completely. So I think if you aren't exercising at all, just start with something small. Even, you know, even 1 day a week is better than 0 days a week. So little steps, each time you get to a little step and you feel like you can do a little bit more, add on to that, and you can build up on that gradually. And that's actually better for your body too, because when you're starting a new routine, it takes a little while for your muscles and your tendons and your joints to adapt, your cardiovascular system. And if you try to go too fast, your likelihood of getting injured is a lot higher. And those injuries a lot of the time will throw people off track when they're trying to start exercising and start being more physically active as well.
Yeah. So, you know, as people start to get more active, start to settle a routine, Dr. Chang, any home workouts that you suggest for getting started, or maybe, you know, not comfortable enough yet going into a gym, whether because of COVID or whether because I don't know, they let their gym membership lapse. So anything people can start doing at home before they start venturing to more aggressive things.
Yeah, I think first starting out with something that's low impact probably makes the most sense. And again, you should be doing this at your own pace. So one of the nice things about starting a physical exercise routine at home is, you know, you could kind of do it by yourself or maybe with your significant other or your family. And so maybe there's not a, you know, a component of shame or being embarrassed when you're around your family members, you know, in the comfort of your own home. You could watch a video, or you could, you know, go online and you could do maybe a yoga exercise, or you could do maybe a Zumba class, you know, or you could do some kind of aerobic fitness thing. And the key thing to remember here is we're trying to exercise your heart. So yes, it is important to maybe tone up and things like that at times, or to try to build bulk, but really the main goal here is to exercise your heart. So we're looking for an aerobic type of exercise. We want to get your heart beating a little faster than you're used to. And so what you want to do is get your heart rate up, but not so much where you're going to get a heart attack. You know, so we're going to challenge yourself, but not that much. Okay, we're going to start out slow. And so I think that's the key to doing this. And really, there's a ton of different things you can do. I would, you know, maybe for the kupuna out there, I really would recommend something like Tai Chi or something like that, that is more slow moving, but it gets your heart rate up and works on your balance, you know, so it helps from, you know, a lot of our kupuna out there have problems with falling a lot. So you do something like Tai Chi, not only helps your exercise your heart, but also it helps your balance, and maybe you don't fall as much. Things like that. And it's going to be different for every demographic, you know. So for the kids out there, you know, I'm probably going to encourage them to get outside, actually out in the sun, where it's safe, pretty much. You know, I think ocean sports are a great way to start right now. I think it's been a boom with ocean sports out in Hawaii. You know, I've seen a ton of new families learning how to surf and things like that. Wonderful thing to do together with your friends and family. You know, so that's basically how I would start out with this.
Yeah, lots of great ideas for activities, getting off the couch. And I know we've already talked about, you know, how to start taking our first steps. Dr. Mills, you know, can we put it into bullet points? What are the first steps and then second steps, and then kind of lay out like a general, you know, general plan to help people get moving? Any suggestions?
I would say, you know, first, a good place to start for a lot of people would be walking, as long as there's nothing that makes that difficult for you. You know, it's something that's accessible to almost everyone, and it's outside, so it's safe with regards to COVID. Maybe try to avoid the more crowded places. I think also, one thing to mention too with the guidelines, like with 150 minutes of exercise per week, that doesn't have to be really intense exercise. So even just walking qualifies. And then if you start feeling like walking's too easy, I need a little bit more of a challenge, you can take it from there. You know, you might consider cycling, getting into exercise classes like Tai Chi. And yeah, like Dr. Chang was saying, I think the water options are excellent here, and those can be really helpful for particularly for people who have balance issues or joint pain, because it supports your body weight. And also the risk of falling in the water is it's not really a concern. You just end up floating. One thing I think to keep in mind with that, though, is particularly if you have diabetes or, maybe circulatory problems, but really for everyone, is, if you're going into the water and you're wading, there's a lot of sharp reef in the ocean here. Most of the pools are closed, and even in the pools, sometimes the bottom of the pool can kind of wear through the skin on your feet a little bit. So if you can get yourself some little neoprene reef booties or water shoes, those are a good thing to have if you're getting into wading or jogging in place in the water.
Yeah, good ideas, Dr. Mills. Dr. Noy, is there a one-size-fits-all approach to this?
No, and everyone's a little bit different. Those are all like great ideas to get stuff started for people who are typically inactive or not used to exercising. And I agree, start off slow, kind of increase it, make sure, you have rest days. If you're not used to exercising, you don't want to burn out or do the same exercises multiple days in a row, because that can increase your risk for injuries. And so usually I recommend, if you're starting off, make sure you have some rest days. And like we've been touching upon the physical activity recommendations, they do recommend like 150 to 300 minutes of moderate activity per week. Moderate activity can be something like just getting your heart rate up, but you're still able to carry on a conversation. Sometimes people who moderate activity is kind of easy for them, then the physical activity guidelines recommend doing about 75 to 150 minutes of vigorous activity a week. So people who can handle, or are used to exercising, vigorous activity would be things like jogging at a faster pace. So you can kind of gauge that by you're breathing heavily and you cannot carry on a conversation. And that's what kind of would qualify as the vigorous type of exercise. And like I said, some people who aren't used to exercising, be sure to have those rest and recovery days. Make sure, you don't make yourself prone to injury. On the other hand, some people who are used to exercising, been doing it a long time, they maybe can do something every day. Dr. Chang mentioned the aerobic exercise, get your heart rate going, is important. The physical activity guidelines also recommend, though, like on those maybe days you don't do aerobic activity, like walking or biking or swimming, do things that actually can build muscle. So even like lifting light weights at home, even things like yoga, tai chi, working on things on balance. You kind of cross-train so that you're still doing those activities, you're still getting in some physical activity, but also at the same time allowing your body to rest. And so again, it's a little bit, everyone's a little bit different, but like Dr. Mills and Dr. Chang mentioned, kind of start off slow and increase it as you feel comfortable.
That's great advice, because not everybody is starting in the same place as somebody else. And what our conversation really is leading up to is, how do we prepare for our virtual race coming up? This year is a little different with Great Aloha Run because of COVID and the circumstances around that. Our Great Aloha Run this year is virtual. Dr. Chang, what is a virtual race, and how is it different than an in-person race?
Yeah, I think this idea of the virtual race is fantastic. It probably doesn't make sense to have hundreds, maybe over thousands of people all around each other, not social distancing and spreading COVID. So obviously we have to figure out a way how we can do a race, or not really a race, or just to encourage people to be active once again, without being, in each other's faces and things. And that's what a virtual race is. Basically, you do it on your own. And so what you do is, on an honor system, you could use a GPS watch or phone to track your activity, but obviously, it's more of an honor system. And the whole goal is just to, 8.5 miles, 8.4 miles or something like that. So the race is this long, right? It's 8.4 miles or whatever. And you have from February 8th to February 15th to complete that distance at whatever pace you want to, which is wonderful, because now all of a sudden, instead of just having, a race where you don't want to be the last one, you could do this and you could take all week to do it. Basically, you could walk 100 feet each day if you wanted to, and then maybe a couple miles in the last day. So it's a wonderful way to get active, to get involved. You know, you get a free T-shirt, and you know, and you can complete the Great Aloha Run and say you did it in 2021, and you can do it virtually.
Yeah, great advice, Dr. Mills. So, how do our participants stay safe while training for the race? You know, any common mistakes or injuries that you've seen pop up?
Yeah, I think generally with running, the vast majority of the injuries relate to the same training mistake, which is just overtraining, doing too much. So generally, you know, you got to listen to your body when you're training. When you exercise, you're actually causing some small amounts of trauma to your muscles and your joints, and then it's after you work out, you feel that soreness, your body's telling you that you kind of pushed it to its limit a little bit, and then it needs to heal. So you want to allow it time to heal. So generally, you don't want to do long runs, more than one day in a row. You know, you might do a run one day and then do something. I was saying the cross training can be really helpful. Every activity, including running, if you just do that one activity all the time and you do a lot of it, you're more prone to get overuse injuries related to that. So I think, you know, if you're, for example, if you're running, if you mix it up and some days you bicycle instead, or you swim, those are other ways that you can, or strength training too. That way you can still work out, you can still work on your fitness on those off days, but your joints get a break from running, and the particular muscles and tendons that get stressed with running get a chance to recover. And generally, you know, if you are feeling soreness, you want to give yourself enough time for that soreness to go away, or at least, you know, 90% gone before you go and do that same activity again. We have a handout here, I believe was emailed to everyone. It looks like this, that covers some of those instructions. So mentions, yeah, the overtraining, cross training. Another guide with that is, you know, if you are running and then during the run or after the run you notice something starting to hurt, a good rule of thumb is you take 3 days off, 3 days for your body to recover. If the pain goes away, go ahead, start running again, but cut your distance down by half. See how you feel. If you feel okay after that, you can gradually build up, increasing by about 10% each time you go run. But if the pain comes back, you know, you try to run again even after resting and the pain comes back, decrease that distance a little bit more. And if it keeps coming back like that, it's probably a good idea to go see your doctor and have him check it out.
Yeah. So yeah, thanks, Dr.
And
Mills.
also,
So
just
those,
one more
sorry,
thing
go
to
ahead.
add to that too, you know, I think that there's a rule when it comes to increasing your mileage that they found is helpful for runners, which is 10%. So if you think about tracking your weekly mileage, like say you run 10 miles in a week, the following week you could run 12 miles, but don't go from 10 miles to 20 miles. You know, if you're increasing too quickly, you're much more likely to get injured.
Yeah, that's a great tip. And just what I was sharing is those materials that you shared, Dr. Mills, they are available and will be emailed out to registrants on this webinar. So participants listening in on this, you will get that information. We're going to close up our content portion of this with a question for you, Dr. Inouye. You know, I know Dr. Mills touched a little bit about training. If you have any other advice about training, and then about recovery from performing a virtual race, and then from there we'll go into our Q&A.
Sure. So like Dr. Mills mentioned, don't just jump into it. Like if you're gonna run a race or do a run, like you probably want to train unless you're used to running that distance. On race day, you're not gonna just go there and just run unless you're used to running that distance. And so there are actually things online or on the internet that you can find. There are trainers that make running programs to gradually increase your mileage. And so I've used those before. Some of the more common ones are like maybe running or walking, because you could do the whole Great Aloha Run with walking. Running or walking, maybe 30 minutes, a couple days a week, and you do more of a longer run on the weekends. That's one example. And then you gradually build up. So like every week, maybe increase your long run 1 or 2 miles until you're comfortable doing the distance that you have for your race or your run. Things that really going to help, and Dr. Mills kind of touched upon this too, is you want to make sure that if you're having some pain or you just need some time to recover, you take those rest days. And part of the recovery is replenishing everything that you've burned, whether that be hydration, like water or electrolytes, calories. And so it's really important that when people are recovering, they hydrate properly. It's not even just hydration during and after the race, but make sure that people are hydrated even before the race or before the run. You also want to make sure that you're getting enough of the nutrients, you're eating well, making sure that you're able to replenish some of the calories that you burned. Other things to make sure people stay safe while they're training is, of course, run or walk in a well-lit area, somewhere that you're kind of familiar with. You want to make sure it's kind of on level ground so it doesn't increase your risk for injuries. Make sure it's not too hot, I mean, right now it's been a little bit cooler, but those are all kind of more environmental things that people can do to safely train.
We've got some great questions on our chat that I'm gonna have you guys address. And Dr. Chang, the data that you quoted with regards to health statistics with inactivity, the 2.3 deaths and whatnot. So you were talking about, our new president initiating, mandatory exercise programs for everybody. What do you think about that as a priority for our schools and our physical education programs in terms of providing students with the foundation at an early age for getting active?
To teach kids and give them the tools so that they can live a lifetime of healthy physical activity. And I think that's really important. So in having a variety of different ways that you could do it. So, if you have a PE program that teaches you multiple different ways to be active, I think that's wonderful, number one. Number two, probably teaching correct mechanics is a good thing as well. I would appreciate that, correct mechanics. And then, I think right now, and I feel like maybe we got a little off topic like this, so I'm just going to cover it really quick. So we got to remember we're in COVID times right now, right? So I didn't talk about this, but we should be wearing masks, right? We should be wearing masks. We should be wearing masks that cover your nose and your mouth, right? Over both your nose and your mouth. And when you wear a mask, it really is not going to affect your breathing. You could run a marathon with a mask on. I have asthma, and I exercise with masks on. I think it's more psychological. Yeah, you can definitely take your oxygen saturation and find that your oxygen saturation is just as good with the mask on or off. So that's one thing. The other thing is to socially distance. You truly got to be away from people. So let's say you're running by someone. I was at the park once and somebody came running by me. He didn't have his mask on and spat basically right next to my foot. That's not a good thing to do, you don't want to spit around people as you're running. And probably the people that you run around with, you better make sure that they're part of your people that you're normally with. Otherwise, you probably want to keep some distance, You probably don't want to run behind them. If you're running behind them and they cough, you're going to run right into it, right? So just things like that. I think is really important. But I would say, I would say it's not a bad idea for the president to think about. I mean, it really is an epidemic. We need to get people more active, because we have problems in our country more than any of obesity, diabetes, hypertension, cardiovascular disease, and that's just part of it, and guess what? Inactivity is probably the biggest contributor to all this type of problems. So I think it's certainly very important to consider.
Yeah, which is why we're, proud to be a participant in the Great Aloha Run, is supporting our community to help people get up and healthy. And Dr. Chang, you touched on something that appeared several times in our questions that came up on chat, and that was wearing a mask. And so maybe Dr. Noy, I'll give it to you. So Dr. Chang touched on exercising wearing a mask. What are your thoughts on a mask as well too? And I guess for you and Dr. Chang, it kind of depends on the type of material of your mask in terms of how easy or hard it is to breathe through. Any thoughts on that, Dr. Noy? And then Dr. Chang, we'll go back to you.
I agree with Dr. Chang. They've done some studies since all of this pandemic started, and they've shown that wearing a mask doesn't decrease your oxygenation. It's not like you're getting less oxygen. It shouldn't be prohibiting you from breathing. On the other hand, I do have patients that tell me, well, when I wear the mask, it makes me very anxious. And so they start breathing heavier. And that might be the sensation that people feel when they're wearing the mask. It's not necessarily that you're not getting enough oxygen. It's, well, at least for some of my patients, they feel just very anxious. And so that makes them have difficulty breathing. The materials of the mask, again, some might feel more comfortable than others. I know for some people, they don't like it when it kind of sucks in, and when they're breathing, it sucks in and goes up into their mouth. And so I can't tell you I don't know of any mask that is specifically good for exercising, but I would suggest you trial a lot of different masks. I mean, who knew when this all started there'd be so much marketing for masks? But there's like so many different masks that you can try. And so I would say trial and error. Find something that fits well, like Dr. Chang mentioned, fits well over your nose and your mouth, and it's something that you would feel comfortable exercising in. And if it is, and so I've told my patient, if it is uncomfortable to wear the mask while you're exercising, then maybe just take it down a notch and don't do it as vigorous exercising, and see if that's a little bit more comfortable.
Dr. Chang, any other thoughts on mask wearing?
Yeah, I mean, certainly when you're doing water exercises, you don't want to wear a mask. But I think if you're in the ocean, let's say you're surfing, then you have to really keep in mind that you should socially distance. And I think the nice thing about being in the ocean and surfing is you really can do that. But you just don't want to be that close to somebody in the ocean because you're not going to wear a mask. And if you do wear a mask, it's almost like, waterboarding or whatever. Yeah, so I would just say don't in the ocean. I think with other activities, though, I think, like we saw with the Safe Sports 808, we seen how Chad Owens and his group, all the kids practicing football, they're all wearing masks. They're all getting sanitized. They're checking temperatures. That's a safe way to do it. And I think that's a great way to get back out and get rid of some of that depression, and get yourself so that your endorphins are pumping again and you're feeling happy about life, because I think it is really important to get outside and enjoy a physical activity.
Yeah, good. That mask question really came up a bit, and I'm glad you also dovetailed in the social distancing along with the exercise. Going to you, Dr. Mills, some of our participants might just have some creaky joints from the inactivity, or maybe even outright arthritis. Any recommendations or thoughts on how you can get them up and running in a safe, maybe pain-free way?
Yes, thank you. Yeah, I think that an important thing, and Dr. Noy touched on this a little bit before too, but it's really important for people with arthritis to understand that exercise is actually helpful. I think a lot of people, and it makes sense, think that, oh, if I have arthritis, I better take it easy so that I don't wear out the joint and make it worse. But in reality, you'll do better with exercise. The movement, the flexibility, maintaining more strength, it seems to be more beneficial, do more good than harm when it comes to arthritic joints. With that in mind, sometimes you do have to be careful about what you do if you're dealing with arthritis, particularly like arthritis of the hips or knees, where it seems like it's most common. Those people tend to do better with reduced weight-bearing activities, like stationary biking would be an example. Generally, people even with severe knee arthritis can tolerate that pretty well. Also swimming, anything in the water, water aerobics classes, once those become available again, as well as just individual swimming or wading is really helpful for that. One thing I notice too a lot of the time with people who have arthritis in their knees is over time they stop straightening their knees out all the way. And most people don't even notice they're doing this. It just kind of happens automatically. So if you are dealing with knee pain, I think particularly if it's arthritic and it's kind of a growing, start paying attention to that. Easy ways if you lie down on your bed or you sit with your legs out straight in front of you on the floor and you just compare the amount of space underneath, particularly if it's the painful knee, it has a bigger gap underneath of it. It means you're starting to lose some of your extension range of motion, your ability to straighten out there. And if you're noticing that, you can go ahead and lightly push down on the knee. Just go to tolerance there. It'll usually be a little bit, but it goes away within a few minutes afterwards. It's okay. Back off how hard you stretch. Also, just sitting in that position with your knee straight or standing with your knee straight and practicing just tightening your thigh muscle, so your quadriceps muscle, just tensing that muscle, and you can hold anywhere from 5 to 10 seconds, like you're trying to push that knee as straight as possible. That's a good way to work on making sure you're maintaining full time. If you lose the ability to straighten out your knees, it makes the problem worse, and it can sometimes cause issues in other parts of your body too, because it changes the way you walk.
Thanks, Dr. Mills. We're coming down to the end of our time, so I think we have time for maybe 2 more questions. Dr. Inouye, bone health. We're talking about exercise and movement. What's a good way to maintain actual bone health?
Oh, that's a good question. So like we've been kind of talking about, activity is good. Actually, some weight-bearing activity, if tolerable, is good in helping bone strength. We want to kind of incorporate, if you can do like light impact, like the walking, getting some type of weight bearing, it can be helpful to help strengthen the bones. You have to be careful though, if patients already have a little bit of like osteoporosis or osteopenia, then maybe those aren't the best ones to start off with. You definitely want to incorporate strengthening exercises for bone health. We typically see osteoporosis more common in females, and stereotypically, females don't do as much strengthening exercises. But doing like even just like lifting light weights at home can actually, if you can build up the muscles around the shoulders and the joints, it actually can help increase bone strength, or at least minimize the amount of bone loss.
Yeah, we're gonna close it out with a question, kind of taking us back to Great Aloha Run this year as a virtual run, Dr. Chang. And there are differences between a virtual race and an in-person race with regards to finish line and an in-person race and motivation and whatnot. What are the differences with a virtual race in terms of the mental challenge of it, and how do you coach people through the mental challenge of participating in a virtual event?
That's a great question. I wasn't ready for that question. Is that something you just came up with? So, I think for a virtual race, it's even easier to coach, because really you could just go at your own pace. And I think the goal is just to finish, and it doesn't really matter. I guess it depends on what you're trying to achieve. Like, let's say you wanted to, run a, well, I should say 2 minutes. I should say like maybe like a, let's say six mile or something like that. Yeah. So I mean, if you wanted to do something like that, then obviously you should have been training a fair amount. You know, but you know, it depends what you really want to do. If for me, it would be just to finish it, you know, but certainly it depends on what your goals are going to be, and you just got to be realistic with your goals. So the guys who are going to get in trouble are the ones who are going to be like pushing it too much. You know, if you push it too hard, that's the ones that come back and later see me because they maybe got an acute stress fracture, or they strained something badly, you know, or maybe even they ruptured their Achilles tendon because they ran too hard. But I think the key is to start slow, like everyone said in this webinar today. Is basically one of the good tenets is if you want to run fast, you got to train slow to run fast. And I think that's really important to remember, because you got to start somewhere, but you got to start slow, and you got to start off like not pushing yourself that much. And with a webinar, I mean, with a virtual race, it's perfect because no one's going to shame you, you know, if you walk, you know, like a half an hour mile, because I'm not going to know, you know. So you know, I think it's a great way to get involved. And let's put it this way. I think the coaching thing you need to have for this is really, why don't you just go out and do it? Go out and do it. Why not? You get a free t-shirt. It's a good way to get physically active once again. Remember, it's so important to be physically active. It's an epidemic, right? It's an epidemic. 3.2 million people died globally this past year because they were physically inactive. Let's get physically active. This is a great way to do it.
That's a great message to end on, Dr. Chang. And Dr. Mills, Dr. Noy, thank you very much for participating as panelists. I want to just comment on a comment that was shared on the Q&A screen, in that, you know, it's really incumbent upon us to spread the word on getting active, not just in the schools and our keiki, but in our elderly and our community. It's part of what we do for Hawaii Pacific Health in terms of, you know, helping create a healthier Hawaii and helping keep individuals at their healthiest. So thank you again very much for our panelists providing insight to our viewers and patients watching at home. We hope you're able to take away some helpful information on creating long-lasting physical habits. Don't forget, the virtual Great Aloha Run is taking place February 8th through February 15th, and you can register at greataloharun.com. That's all one word, greataloharun.com. As you have heard on today's program, Hawaii Pacific Health offers comprehensive services, including sports medicine, physical therapy, and rehabilitation that can support the medical needs of not just you, but also your family and your friends and your loved ones. From virtual care, video visits, or phone or in-person visits, we're here to help you keep your healthier and stay healthy. If you have any questions regarding our services or today's webinar, please visit hawaiipacifichealth.org. That's one word, hawaiipacifichealth.org. Thank you for joining us today, and we hope you stay healthy, safe, and live aloha, helping create a healthier Hawaii. Thank you.
Thank you.